Make sure, if you are going to have kids, if you are taking a prenatal vitamin, that it does not contain folic acid. Folic acid. It's in your prenatal multivitamin, bread, flour. It's in all sorts of enriched foods that you might be eating. This study found that higher levels of unmetabolized folic acid, a synthetic form of folate found in most prenatal vitamins, in umbilical cord blood in Black children was associated with a significantly higher rate of autism spectrum disorders.
Classic Paul, fear-mongering folic acid which literally prevents neural tube defects in babies. Time's cool. First of all, over 80 countries around the world, including those with free healthcare systems, fortify their flour with folic acid. Do you want to know why? Because it's a major public health success that has saved countless thousands of babies. This meta-analysis that included 3 large randomized control trials and several observational studies shows that folic acid supplementation for women with a previous pregnancy with a neural tube defect indicates a 70% reduction in the reoccurrence of neural tube defects. And as primary prevention, it leads to a 62% reduction in the risk of neural tube defects. Then he cites this observational study on just 567 babies from a specific subgroup as his proof that folic acid supplementation increases the baby's risk of autism. This is truly mind-blowing, seeing as though he's the first one to disregard observational data on vegetables being good for you, but for some reason observational data is good enough to fearmonger folic acid. Secondly, this wasn't even testing the effect of folic acid supplementation. It was looking at unmetabolized folic acid in umbilical cord blood. A completely different metric to assess, which is not even proven to increase your risk of autism in the first place. Also, they didn't even test the amount of unmetabolized folic acid in the mother's circulation. So you can't attribute the unmetabolized folic acid in the cord to the mother. And not to mention, the Boston birth cohort had a high number of preterm births, which is a consistent risk factor for autism spectrum disorders. But wait, here's the actual kicker. This meta-analysis of 10 and 23 sub-studies on almost 10,000 autism cases found that folic acid supplementation during early pregnancy was associated with a 43% lower risk of autism spectrum disorders. And the same is seen when looking at folic acid from dietary sources and supplementation. So not only is folic acid supplementation effective at preventing neural tube defects both in supplements and in food, but it also leads to a lower risk of autism spectrum disorders, the complete opposite of what Paul said. I'm not joking, all this guy does is cherry pick absolutely garbage research to fearmonger yet another thing. Just ignore his videos. Class dismissed.